Mississippi was really third world. There was no systemized care for blacks or really much systemized care for anyone.
The medical committee was formed directly in response to Freedom Summer, in response for people, especially Bob Smith, saying that we need help down here.
There's nothing but progress that we have to look at, and while it may have taken us a little bit longer, we are on the trajectory of improvement.
Hello and welcome to a special edition of Southern Remedy. I'm your host, Dr. Rick DeShazo. Much has been written about the long struggle by African Americans for civil rights in Mississippi, but historians have written little about the health issues of the civil rights era or the black physicians in the state who played a central role in the movement. One historian who has written about the Mississippi civil rights movement and the role of physicians in it is Dr. John Dittmer.
Good to be here.
Mississippi black physicians involved in the civil rights movement were doctors first and civil rights activists second. One of the best known of these physicians, and one Dr. Dittmer's written about, is Dr. Robert Smith. He personally coordinated the health care for over 1,000 college students and other civil rights workers who came to Mississippi 50 years ago. Dr. Smith, thanks for joining us.
Thank you, Dr. Rick.
How the social determinants of health, things like access to care, poverty, culture, and race, among others, is an area of expertise for Dr. Bettina Beach, a public health expert and Associate Vice Chancellor for Population Health at the University Medical Center. Dr. Beach, thank you for being with us
Thanks
today.
for having me.
Dr. Dittmer, let's start off talking a little bit about what was going on in Mississippi in 1964. What was the social climate during that period?
Well, the social climate in 1964 hadn't changed much for nearly 100 years. You had a totally racially segregated society. The Jim Crow era began in the late 19th century and affected every aspect of relations between the races. Not only did you have rigid segregation in schools, lunch counters, public accommodations, but you also had blacks doing the same kinds of jobs, by and large, that they did during slavery. In short, we were locked in a Jim Crow society of racial segregation, and things did not begin to change until the mid-1950s.
So what was the tipping point that began to get things to move on differently?
Historians have different interpretations of why that happened. I think in Mississippi it was probably the Brown decision of 1954, which ruled that schools could no longer be segregated. Now in Mississippi at that time, Brown didn't desegregate any schools, but it did two things. It gave rise to organized white resistance. The White Citizens Council, the Uptown Ku Klux Klan as it was called, the best citizens, lawyers, doctors in small towns and bigger cities. The Citizens Council was formed specifically to stop school segregation. You had the government then founding the State Sovereignty Commission, which was a state spy and propaganda agency that was very active during this time. On the other side, for blacks, although schools weren't integrated, why they believed that now the federal government was on their side, and that they could take bigger steps in voter registration. So these two events were coinciding, and there had to be a clash of this, and it came in the 1960s.
Dr. Smith, what did you find was going on in health care for African Americans when you started practice in Mississippi, and what concerned you about it?
So when I came back down to Mississippi in the early 60s, Mississippi was really third world. There was no systemized care for blacks or really much systemized care for anyone. When you look at infant and maternal health mortality, most black kids was born at home with a granny midwife. And in some counties, the infant mortality rate was 60 to 80,000 per thousand, and that was by granny midwife reporting. There was no system at all for treating and managing chronic diseases such as treatable diseases such as hypertension, diabetes, Many people lost their limbs and their feet or heart disease, no chronic disease management whatsoever. In addition to that, treatable diseases such as mumps, measles, infectious diseases was rampant. People died from pneumonia at home. There were areas in this state where blacks didn't have access to hospital privileges at all, even on a segregated basis.
So there were a lot of parasites as well. I understand that there was no plumbing in many homes.
That's exactly what I was going to talk. John mentioned the social situation. Blacks at that time, the average income for blacks earned in dollars was $500 to $1,000 a year. Most black homes didn't have indoor plumbing and substandard housing. Educational level was the third to fourth grade. So it was a problem of lack of education, lack of access to just any kind of general system of health care.
Well, in 1964, the Civil Rights Act was passed, and it had a title in there that specifically addressed access to hospitals and so forth for all Americans. How did that change health care for African Americans, or did it?
Oh, it was I won't say a dramatic change, but when the federal dollars became involved, it was the beginning of federalization of health care, and of course, a few institutions in the state with prodding wanted those federal dollars and began to desegregate begrudgingly.
So, Dr. Beach, we've been talking a little bit about this whole area of health disparities and how the civil rights movement had an effect on those. What is your view as an epidemiologist, public health person, of what was going on before and after the Civil Rights Act?
I think Dr. Smith clearly elucidated and spoke to some of those health disparities. The social conditions really underlie and reinforced those disparities that we saw, with disparities simply being a difference in health and health outcomes for certain racial groups. And it doesn't have to just be race or ethnicity. It could be gender, it could be age, it could be geographic residence. So it's simply a difference in health. And what we saw were very stark disparities between whites and blacks at that time. And even though in '64 legislation opened the doors for federal dollars to come in, those health disparities are recalcitrant. They stood for a long period of time.
Can you give us some examples of what health disparities are and what kind that were being seen during that period?
So I think Dr. Smith spoke to hypertension. Let's say that. Differences in the amounts of 10-fold difference between whites and blacks, and in certain areas they might have been even more stark than that. We didn't see a change in that until '66, but during that time in the '60s, they were very stark and very little access to care outside of a few areas, and care provided was quite different.
During this period of 1964, Dr. Smith, you actually were involved in providing health care for all of these civil rights activists who came to the state to participate in Freedom Summer. Why did you have to get involved in that whole process? Did that have anything to do with disparities?
Well, it was very simple, Rick. As I mentioned to you before, between the Flexner Report and aging black physicians, the country didn't train but about 175 to 200 black physicians. Only about 3,000 or 4,000 nationally, and only about 20 or 25 of us that was in the state. And believe it or not, during that era, sometimes local black people had trouble accessing health care if they tried to register to vote.
There was a problem not only with how much health care was available, but how many providers were
How
here.
many providers.
And the quality that they could get.
And the quality. So obviously we had to do something. We couldn't take care of this large influx of people. And at that point, black physicians had absolutely no access to the administration at UMC. We tried. I was president of the local medical society and wrote just for access to come and sit in the chair for continuing education, and got no response.
The medical center would not let the black physicians in.
That's correct.
The medical center was totally segregated.
Totally segregated.
And I don't think there were any black physicians on staff.
No black physicians was on staff.
He was putting together all these doctors to take care of these many white college students who were coming down here for Freedom Summer. What were they coming here for?
Well, they came because they'd been invited. The idea behind Freedom Summer was that in order for things to change here, you had to have help from the outside. You had to have the federal government involved, and the best way to do that, they found, was to get white people, many of them from prominent institutions. One was the son of a congressman. Get them down here, shine the light of the media on Mississippi, let them see what it's like, and then maybe an outraged American public will demand that the federal government do something about what was going on
here. So let's clarify that issue. This was the first time many of the black organizations, civil rights organizations, there were 4 or 5 of them here in the state, had involved whites in demonstrations and other activities. Why was that?
In any number. The Student Nonviolent Coordinating Committee, or SNCC, was the major organization working in the state. And there were a handful of whites who were working mainly in the offices. But they were not encouraging a lot of whites to come down for several reasons. One, that it would be very dangerous. To see whites in a black community would draw attention to them. And it was just felt that as long as you're just having small local organizations, you had local blacks who were being trained by these outsiders who were coming in, developing local leadership. But that strategy had to change once you had the rise of the Ku Klux Klan, escalating violence. It became impossible to organize. So you had to make this change, bring in large numbers of college students. It was assumed that most of them would be white, and turn them loose all over the state and see what happened.
You have written rather extensively about the Medical Committee for Human Rights, of which Dr. Smith was one of the founders. What was their role in this whole thing? Because that was a national organization that he was involved in, but they were functioning locally during Freedom Summer. How did that work?
Well, the medical committee was formed directly in response to Freedom Summer, in response for people, especially Bob Smith, saying that we need help down here. The SNCC and the rest of the civil rights workers agreed. So this organization was founded in the spring of 1964 in New York, and you had all these doctors and other healthcare workers that were going to come down and help. It became a very popular thing. But without Dr. Smith here to meet them and to initiate them into the ways of Mississippi and the ways of Mississippi medicine, why the medical committee never could have gotten its start. So he is a very key person in the success of this organization.
So it wasn't just doctors that he brought down, and I want to get you to clarify this. It was other people, social workers, nurses, and clinical psychologists. And I read somewhere in one of y'all's writings about this whole thing of PTSD, that actually post-traumatic stress syndrome was one of the first time it was really appreciated was in some of those workers.
That's exactly. That was a very common problem among PSD, and in fact, I suffered from it too.
And what we're talking about is the stress and fear of what was going on, especially after we had the 3 civil rights workers killed in Philadelphia. People were under siege. So what were these doctors and other health professionals doing?
These health professionals, we really did 2 or 3 or 4 things that became very significant. Number one, we were available, cut down on violence by going out to these freedom schools, participated in the demonstrations when they would notice doctors. There was less violence, number one. Number two, we documented the lack of basic health care in communities that later resulted in us coming together in December of 1964 in Greenville to talk about a new institution that evolved into what we call neighborhood health centers.
So, Dr. Beach, we're talking about access and health disparities, and Dr. Smith, who's very humble about this, was one of the key people who were involved in the founding of this whole federally qualified health clinic. We have these, over 21 of them, with hundreds of locations in Mississippi now that are providing health care to folks who just wouldn't have had it otherwise. What changes have scholars seen in health disparities in Mississippi as a result of what happened here in Freedom Summer?
We saw stark changes from '68 to 1980 where health disparities reduced. And again, let me say, disparities is a difference. It's a difference measure. It's not the best measure because you're not looking at the absolute condition. And so we saw changes in both the absolute condition of African Americans and the relative condition of African Americans compared to whites. It was after the 80s, though, that we saw a reduction.
So this is death rates, what age you died from,
That's right.
what you died of, what the complications of
That's
that were.
right.
All those sorts of things were what you're talking about.
That's right. Morbidity, mortality, all-cause mortality, and then all of the different health indicators as well.
So right after the Civil Rights Act came in, there was access to hospitals.
That's
These
right.
community centers kicked in.
That's right.
There was financing for people to see doctors, and then what happened?
That's right. And then we
what's going
lost
on
a
now?
lot of those social programs through reductions. And we are seeing an increase in health disparities since the 1980s.
So what's going on now from your perspective, looking at all the population data in Mississippi? Are we good? Are we awful? Where are we going?
Well, again, it depends on the indicator. We've done extremely well in immunizations, childhood immunizations. We're nearly at 100%. So we lead the nation in childhood immunizations. For almost any other indicator, we're 50th. In life expectancy, in diabetes, and every chronic disease, we are 50th in the nation.
So why is that?
We're 50th in the nation, but let me say to you that the last indications that I've seen since the 60s, life expectancy is up in Mississippi, depending upon whether you're talking about black males or
That's
white
correct.
males, about 15 to 20 years.
That is
The
correct.
life expectancy in the 50s was around 50, in the mid 50s.
So
And
are you
black males-
optimistic?
Well, you have to be optimistic, even though we remain 50th in the nation in every indicator, as she says, except one. But as long as we can work together and have some racial reconciliation and treat people as people, then and guarantee everybody the right to good health care, improve the social conditions, we can't help but see improvement.
So we talked a little bit about the social determinants of health, and in Mississippi, poverty is always one of the first ones that comes up and one that we struggle with. And we're not talking about just blacks. We're talking about lots and lots of poor white working poor as well. What has got to be done here to bring us out of last place going forward from a population standpoint?
Well, let me dovetail on the positive comment that Dr. Smith was making. I'd like to say public health had a lot to do with that. So as you're talking about sanitation systems that didn't exist, that people had to use restrooms in places where water was being consumed as well. Sanitation conditions had a lot to do with it. So public health has made a lot of changes. So the life expectancy issue was not just health care, but health. And that's where the social determinants of health come in. So again, that's simply looking at income, education, residential situations. We need to move away from thinking that you go to the doctor just to get health. Health begins long before you ever go to the physician. It begins at home. It begins where we work. It begins where we worship. It begins where we live. And we need to start thinking that way and not just thinking of health and health care as synonymous. They're very different. And so in Mississippi, we're moving toward focusing on health and wellness as well as increasing access to health care.
We're looking now at retrospectively what are the outcomes, the social outcomes, the medical outcomes of what happened here in Freedom Summer. How do you sort of judge that looking back today? Is it helped us get directed in the right direction?
Yeah, quite simply, Freedom Summer changed the state and it changed the nation. Nothing was the same after that. Up until Freedom Summer, why the main ethos among white people in the state was to preserve the status quo, do anything to defy the federal government. After Freedom Summer, after the death of the 3 civil rights workers, when the world's attention focused on Mississippi, why it marked the beginning of the end of massive resistance. For example, when the Civil Rights Act was passed, the State Chamber of Commerce said, we don't like it, but we ought to obey it. Well, the Citizens Council people were furious, but there was nothing they could do. When they called for the desegregation of a handful of public schools in Jackson and other places of the state in '64, it went off peacefully. Now, there were going to continue to be problems, but this reign of terror began to end. The terror, and we hear it in a different context now, but that's what we're talking about in terms of Mississippi in the mid-'60s. That began to decline. Blacks won the right to organize. They, of course, have more elected officials in the state now than in any other state. And the Mississippi Freedom Democratic Party, which challenged the all-white segregationist party at the National Convention in Atlantic City, was responsible for opening up the Democratic Party to African-American participation and directly made the nomination and election of a black president possible. So there are tremendous ramifications for Freedom Summer and what it accomplished.
Dr. Smith, we'll give you the last word. You are part of all these pieces, the Freedom Democratic Party, all of that stuff. We still have 2 medical associations in Mississippi, a white one, mostly white one, and a black one. We still have health disparities that Dr. Beach has outlined. We still are last in health. What's next? What do we need to do to fix this situation?
First of all, Rick, let me just say to you that also with the death of Medgar Evers, that brought black physicians kind of out of the closet, so to speak, although black physicians had been fighting and decided they had to form a coalition with white physicians to get something accomplished. As John had said, with Freedom Summer, the most important thing that came out of that was, of course, obviously the Civil Rights Act. And with the Civil Rights Act and Johnson, a plethora, just a cascade of medical programs that included federal qualified health centers. Most people don't realize that the Medicare law was signed into law with the testimony of 2 black physicians, Montague Cobb and Kenny Clemens. Many young physicians do not realize that the program that started here in Mississippi with physicians coming from the north to demonstrate that we had poor physicians led to federal legislation to increase the size of medical schools and to build new medical schools to address the health manpower problems. And I could go on and on and on. The decentralization and regionalization, all of that was movement stuff. Health planning laws, those laws that look at states and force them into doing some things for all the population were mid-'60s stuff. Along with one great law, and that was Medicaid. And one of the unfortunate things that the Affordable Care Act didn't do, President Johnson attached Medicaid to Title 19, the potential for losing monies that states couldn't lose. Otherwise, we perhaps wouldn't have a Medicaid program. So that whole thing really changed health care, not only for Black Americans, but for all Americans. And it's left up to us now to try to increase the level of education of people K through 12, to talk about making our state economically friendly, regionalization, and supporting programs and coming together for reconciliation and working together for a complete society.
Dr. Beach, in 2030, the population of Mississippi is going to look a lot different. We're going to have 50% of the people in our state as being people of color. And it's probably going to grow from there. How do you see that affecting health disparities when that group, that people of color group, is already significantly adversely affected as compared to the others? What can we anticipate? Will this group demand better health services or access to care? Is there any optimism coming out of the future, or is it just going to be more of the same?
No, I think there's a lot of optimism, and people are gaining access to health care and improving their health indicators. On a population level, it takes a long time to see that happen, but we certainly see smaller pockets of optimism that are occurring. So I think things will continue to improve as they are now, and I think looking at 2030, we need to achieve equity again, not just looking at disparities. As I mentioned before, that's a crude indicator of looking at health. But as people work together, again, through racial reconciliation and other areas of reconciliation, we can improve the health of Mississippians, not just of African Americans or whites, but of Mississippians in trying to improve the health of the nation.
I want to thank our viewers and Doctors John Dittmer, Robert Smith, and Bettina Beach for joining us. For all of us at Southern Remedy, I'm Dr. Rick DeShazo. Good night.
Southern Remedy is underwritten by a grant from the University of Mississippi Medical Center.